So, if someone is being treated with medication for high blood pressure, how low should their blood pressure be with that treatment?
The decision to treat high blood pressure and the target for treatment should always involve a discussion between the patient and care provider based on the patient's values and the best scientific evidence out there. Generally, people will target less than 140 on 90 for treatment for people that have a diagnosis of hypertension, and that's stage two. However, there is some evidence to suggest that controlling blood pressure and getting it lower, even under 120 on 80, can provide some additional benefits. So if people tolerate the additional treatment and they're interested in trying to pursue those additional benefits and they're not having side effects from the medications, then you might want to target a lower blood pressure than 140 on 90. The other things to consider as well is orthostatic hypotension. So having your blood pressure fall as you stand increases in prevalence as people age. And so that needs to be monitored for so that people aren't falling down or getting dizzy when they're standing up. And oftentimes people that have diabetes or Parkinson's disease can also have this problem. So it will depend a little bit on what the patient is interested in and whether they're interested in taking medications. It will depend on their underlying medical conditions. And it will depend on whether they really want to pursue those additional benefits that may take place. For the patients that have orthostatic hypotension or the drop in blood pressure when they stand up, you may need to target a higher baseline blood pressure so that they have room to fall. And so that's another consideration as well when coming up with a reasonable blood pressure target.